First, I will make sure that I have all my proper equipment. I have my stethoscope, I have my gloves, and I have my pen light, and I'll perform infection prevention by washing my hands and by cleaning the end of my stethoscope. First, I will assess for any assistive devices. Do you use any assistive devices?
No.
Patient reports no use of assistive devices. And let me know if you have any pain throughout the entire assessment.
Okay.
So first I'm going to ask you your name.
Amy.
And what town are we in?
Portland.
And what day is it?
Thursday.
Patient is alert and oriented, speech is clear, and patient was able to respond to all questions appropriately. Next, I'm going to give you 3 words that I'm going to ask you to repeat back to me later on in the assessment. So your 3 words are painting, sweater, and lotion.
Okay.
Got it?
Got it.
All right. So next I'll assess the cranial nerves. So can you smile and frown and raise your eyebrows and puff out your cheeks? Cranial nerves are intact and patient was able to respond to all commands appropriately. Next I'll test the pupillary reaction. Pupils are equal and round and both are reactive to light. So I'm going to have you stand up and walk towards the door and walk back. Patient gait is normal, no signs of swaying or limping. Patient's movements are coordinated. Next, I'm going to have you stand on one foot and the other. And can you hold your arms out like this as you close your eyes? Patient is able to maintain balance through all 3 tests. Next, I'm going to assess for fine motor skills. So hold your hands out again and touch your finger to your thumbs and back. Fine motor skills are intact. Next, I'm going to test patient sensation. So I'm going to have you close your eyes and I'm going to touch different places on your body and you're going to tell me where I'm touching.
Left shoulder. Left foot. Right arm. Right leg.
Patient sensation is intact. She was able to name all the places that I touched appropriately. Next, I will assess the spine. So I'm going to have you dive down and I will palpate the spine. Okay. No curvature of the spine. Patient's posture is erect. No signs of lordosis, kyphosis, or scoliosis. Next, I will assess the gross motor skills. So I'm going to have you move your arm in a big circle. And this one as well. Full range of motion in both arms, no crepitus in the shoulders. And can I have you extend your elbow? No crepitus, full range of motion. No signs of crepitus and full range of motion in both elbows. Next, I will test your wrists and can you move them in a circle? Patient has full range of motion and no signs of crepitus in either wrist. The skin is warm and smooth and pink and dry to the touch. Turgor is good, no tenting. Palpate the fingers. Capillary refill is less than 3 seconds. And I will have you sit back down. Next, I'm going to assess the head. Head is midline and neck is erect in midline of the body. We'll also assess the hair. Okay. Hair is evenly distributed across the head and texture is normal. There are no signs of lice or any other critters. When inspecting the scalp, there's no lesions, masses. Next, I will assess the trachea. Trachea is midline, and can you swallow? Patient has no difficulty swallowing. Thyroid is not palpable, indicating no signs of goiter. Next, I will assess the range of motion of the jaw. Can I have you open and close your mouth for me? Patient has full range of motion of jaw, no signs of TMJ. Next, I will assess the sinuses and the lymph nodes. Let me know if you have any pain or pressure throughout this. Any discomfort?
No.
Patient reports no tenderness or pressure, no signs of infection or drainage from sinuses and lymph nodes. Next, I will assess the ears. Palpate both ears. No signs of any nodules or masses. Ears are symmetrical, size and shape is appropriate to the patient's body. There are no signs of drainage either. Next, I will assess the eyes. Eyebrows and eyelashes are evenly distributed across the face in appropriate size and shape. There is no edema of the eyelids. Sclera is white, indicating no jaundice. Pupils are small, round, and black. Irises are blue. And can I have you look up and down? Conjunctiva is pink. There are no signs of drainage or infection. Next, I will perform the 6 cardinal fields of gaze. So I'm going to have you follow my finger. Patient is able to follow finger. Occipital nerves are intact. Now I'm going to have you stand up. Take a step forward. I'm going to stand behind you. I'm now assessing for peripheral vision. Let me know when you can see my fingers.
No.
Peripheral vision is intact. You can sit back down. Next, I will assess the nose. Nose is center and midline to the body. Have you had any difficulty smelling?
No.
Patient reports no difficulty smelling. And can I have you cover one nostril and breathe in and do the same with the other? Patient is able to breathe through both nostrils bilaterally, indicating no deviated septum. And there are no signs of drainage. Next, I will assess the mouth. Lips are pink and moist. Can I have you open up? Say ah.
Ah.
Uvula is midline and tonsils are intact. Open one more time. The mucosal membrane of the mouth is pink and moist. Can I have you stick your tongue out? Tongue is pink and moist as well. No sign of deviation. And smile for me. And open up again. No signs of any plaque, odor, or cavities. Are you having any trouble tasting?
No.
Patient reports no trouble tasting. Next, I will assess the lungs. Can I have you stand up and face that way? I'm going to have you take a deep breath for me. Patient shows no difficulty breathing. Lungs inflate bilaterally and symmetrically. And face forward. Now I'm going to listen for the lung sounds. There's also no signs of barrel chest. Take a deep breath. And again, face this way, please. Deep breath. And again. And last time. All right, you can sit back down. Patient lung sounds are clear. There are no signs of any wheezing, rhonchi, or bronchi. Next, I will do a cardiac assessment. Going to listen to the heart sounds. Patient has a normal rate and rhythm. There are no signs of any murmurs or whooshing. S1 and S2 are auscultated, indicating that mitral and tricuspid valves are intact. Next, I'll do an abdominal assessment. So can I have you lay down and bend your knees? And do you mind lifting up your shirt a little bit for me? Next, I'll listen to bowel sounds. All right. Bowel sounds are present in all 4 quadrants. And I will also listen again for venous sounds as well. After listening to the vascular sounds, there are no signs of aortic aneurysm. I'll now palpate the abdomen in all 4 quadrants. Let me know if you have any pain or tenderness as I do this.
Okay.
Any discomfort?
No.
Patient reports no discomfort. There are no signs of any edema or ascites or distension. You can put your shirt back down. And I'm going to have you stand up for me one more time. And can I have you bend your knees like this? And put down one more time. And again. No signs of crepitus in knees. Patient has full range of motion, and I'm going to have you move your ankles in a circle. And again. Patient has full range of motion in both ankles, and there is also no signs of crepitus. And that concludes our assessment.